Hi, good morning everyone, and welcome to this week's webinar. I'm Jeff, I'm the director here. I'd like to acknowledge the traditional owners in which we're gathered and are learning today, and pay respect to elders past, present and emerging, and extend that welcome to people joining us in person or in webinar land. Today we have Gerard Moloney, who's the Client Services Manager for Gambling Services for Lives Live Well, and he's done some work over the past year or so on developing a problem screening for gambling, which is very relevant to our work in terms of the addiction space. So it's my pleasure to invite Gerard to the stage to tell us more. Thank you, Gerard.
Thank you. The problem gambling screening tool is not one I developed. so thanks, Jeff. It was developed by the Canadians, and it's called the Problem Gambling Severity Index, and we'll get to that later on. This project is funded by the Queensland government, so we just wish to acknowledge them. Where we will go today, we'll look at the links between substance use, mental health and problem gambling. Then we'll look a little bit about the characteristics, why screen, and then the tool itself that I just mentioned, and then look at the role of brief interventions and referrals to specialist services. There is a Gambling Help Service, of which there are 14 locations across the state of Queensland. So links to those services are pretty important. So we'll start off with a couple of definitions, and I'm going to drag out DSM just for a moment. So hopefully I won't offend anybody by doing this. In DSM-4, if anybody is read up on DSM, back in 3 and 4, they talked about gambling as being pathological. They talked about pathological gambling. So you've seen that title around, I'm sure. But in DSM-5, they started talking about gambling disorder. And what they called that then was a persistent and recurrent problem that people had that caused significant impairment or stress for the person. So they also, in changing the name, they changed the location. If anybody in the room is aware of that change? Yes? Oh, we got a nod. I think that's my first person who's actually known that. So pathological gambling in DSM-4 was in the impulse control disorder chapter, not otherwise specified. Now, that's a bit of a mouthful if you're trying to specify something. However, they moved it over now. They've changed a little bit. They've moved it over to the substance-related addictive disorders chapter, and there they've called it a non-substance related disorder. Okay, so it's now into the addictive disorders chapter. That's a pretty major change. So in terms of conceptualising what the issues are here, there's a fair bit going on in the background. Even if we in Australia might not be all reading off the DSM page, it's at least that's a background change that's happening. Certainly in the US and around the world. So why did they actually do this change, and how did they do it? Well, one of the ones was that with the improvement in MRI and all those different methods of actually checking out the brain, is that when they wired people up for substance use and then ran them through an MRI, there were certain parts of the brain that lit up. When they actually had them do a game or some sort of process, then they looked at them in the MRI, the same parts of the brain activated. Right, so there was no difference between a chemically induced substance that was put into the body and a person doing a game. So probably into the future what we're going to see is these non-substance related disorders might all end up there. Things like gaming itself, where just the games, the phone issues, maybe the pornography and sex issues, all those things might end up in there. But that's not for us today. So the reason then, just to summarise that, the reason why they've put disordered gambling into the DSM chapter on addictions is that the two sets of disorders are characterised by much the same symptoms. They share the same origins, and many of the brain mechanisms appear to be very similar. Another definition is, in Australia, we tend to talk about problem gambling. And if you've heard about the Productivity Commission, the Productivity Commission has embraced this definition back in 1999. And they're the Australian government research body that when the government asks for information on a topic, they do the work. So I'll refer to them a few times, and they have done two studies into gambling, one in 1999 and one in 2010. and that in itself is pretty unusual, because usually they don't do too many topics in such a small time frame. So problem gambling is described as characterised by difficulties limiting money or limiting time. So it's a bit of an extension from the DSM definition, which leads to adverse consequences for the gambler, for others and for the community. So they bring in the effect on others a lot more. There are a few other titles that are often used about gambling. You may have heard of these. It's compulsive gambling, addicted gambling, excessive gambling, and I think in the past they called it neurotic gambling. So it was all pretty friendly names. If you had a bit of a problem with gambling, you mightn't be fronting up to get that label. The Productivity Commission also embraced the idea of a gambling continuum. So this ranges from no problems or low problems, where gambling is seen as a form of entertainment or a social activity. It then shifts up into moderate problems, where people start maybe to chase losses. It starts having an impact that they haven't got any excess money or they actually can't pay their bills, until it moves up into severe problems, which are listed there as you can see, which probably would fit into any diagnosis of disordered gambling that DSM is talking about. So there's just a little background in terms of the definitions. Around the world, gambling disorders, the studies range. That's a pretty big range if you're looking at who's affected, from 0.2% to 5.3% of people. In Australia, that range is a little bit less. It's probably from 0.5 to about 3.2 in the studies that have been done in Australia over the last 20 years. The Productivity Commission, though, estimated that roughly 400,000 people were affected by problem gambling. They also put out that they estimated that between 5 and 10 people were affected for every one problem gambler. They were the people who were influenced, whether it be family or friends or social situations. So if we did if we do the big one, do 10, I can multiply it by 0 pretty easy. It will bring us up to 4 million people in Australia affected by problem gambling. If we cut it in half and go to the bottom number, that's still 2 million, which is, and they're on 2010 figures. They're not anything that's current. In Queensland, you may have heard of the Queensland Household Gambling Survey. You may not have heard of it. It's been done 6 times. And the most recent survey, 2016-17, came out last week. So it's hot off the press, so it's fairly up to date. It's a telephone survey. They have 15,000 people in the sample, which is an awful lot of telephone calls if you've done that. And the first 2, I think in 2001 and 2003-04, they were 30,000 sample sizes. So they've had quite large sample sizes. They are telephone and they are long calls, about 45 minutes it takes per person. So the most recent 2016-17 survey gives some indication of where do people participate in gambling. So most people think it's going to be poker machines or somewhere there, and it's not. Most people participate in the lottery products. So all the lotto stuff through the newsagent, all those. Maybe many of us engage in that as well. There's a lot, 25% in art union tickets, 25% in pokies, then horses and harness races. You can see the numbers there. This is really the first time that they've actually looked at internet and phone gambling. So this here is 8%. It's a little bit difficult to explain it clearly in that there's lots of little bits and pieces like stuff on TV shows. They're all there. However, what's important is that participation in gambling also is in all those other categories as well. It's not just the specific internet or phone. You can bet on horses on your phone. You can bet on dogs. You can bet on any of the sports games like football, cricket, you name it, soccer, any of those things. So what they have done, this is the first time they've actually looked at this, is that for all gamblers, 17% of them are using basically their phones or a computer to gamble. But when you look at the problem gambling group, they're up to 39%. They're using that. And the moderate risk group is 34 and the low risk 32. So it's The recreational gamblers are 15% using that. So it just gives you some indication of how people actually gamble. So here's a basic comparison of the 6 surveys over time. And the thing to note is that the non-gambling section is increasing a little and the recreational gambling is decreasing. However, the risk areas, low risk, moderate and problem gambling people are not changing much at all. And the figures in the last one, just to give you an idea, is that problem gamblers are 0.5 of 1%, moderate risk are 2.5% of the population, and low risk are 6.4% of the population. So we put that together, we're getting pretty close to 10% of the population being affected. So let's have a look at the relationship between substance use, gambling and also mental health. So among problem gamblers, 75% also have a problem with alcohol. And these are studies, the international studies that were done. 38% of all problem gamblers have a problem with other drugs. The link with alcohol is probably understandable, because up until all the electronic gambling that's now come in, the place you gambled was at a pub or a club. And if it was illegal, there was usually alcohol there anyway. So there's a strong association between alcohol and gambling, and other drugs as well. This slide is looking at, this was a study on people who were in treatment for alcohol and drug, and they were identified as 14% of them across those studies. There were 30 studies, and of those, 14% of people in treatment for substance use were identified as pathological gamblers. So that gives us a hint it was done under DSM-4. So these are older studies. However, 23% of those studies, when they looked through them, 23% met the criteria for problem gambling. So these are people in treatment for alcohol and drug. So they concluded that 20 to 30% of people in alcohol and drug are likely to have problem gambling. In Lives Live Well, in our residential services, we've been systematically screening now for about 12 months, and those figures, it's actually up the high end of the 20s. It's actually interesting that it's pretty 26, 27, 28%, it varies around there in the problem gambling. But then we got anywhere from 11 to 15% in the moderate risk, which is completely, usually it's the other way around. The numbers go up and you find down to the problem area. These are the problem area, and then it finds back down. So there's less in low risk and less in moderate risk in the rehab centres. So that's sort of just interesting how the data goes backwards there. So when we looked at the household survey, what did it say about that? 52% of people who identified as problem gamblers said they had an immediate family member with drug or alcohol issues. And 35% of the problem gamblers had a problem. And 62 or 55% of those categories as listed there also had actually gambled while under the influence of drugs or alcohol. I always find it interesting as a social, cultural issue for us as Australians. We are pretty thingy about 0.05 for drink driving, and we know that that's the cut-off where people start losing their ability to make good decisions. But we have no problem with thinking that drinking and gambling, people are quite capable of making good decisions. So it's just, I always find that a bit of a quirk that I too have to ask that question about myself. So turning on to mental health, this was a meta-study done in Australia looking at, and these are not treatment samples, these are actually community samples. So amongst problem gamblers, 58% had a substance use disorder, which fits in with what we saw in the previous slide. 38% had a mood disorder, 37% had an anxiety disorder, and 28 or 29% had some form of antisocial personality disorder. So they're fairly big numbers of links between gambling and mental health. In the household survey, here are the figures from the self-reports in that survey, and 52% of problem gamblers said they had depression. And we've got the other topics, other amounts listed there. In a previous household survey, not this last one, they didn't ask this first question, which I find very surprising. And that 14% of problem gamblers in the 2011-12 survey had thought about suicide. And 34% of problem gamblers, 20% of moderate risk gamblers had seen a doctor for depression in the last year. So it's not that same sort of trend is showing up there. So we'll move on to some characteristics of people with gambling. And one of the main characteristics is the stigma and shame. And as a result of that, problem gamblers are often hidden in the population of people with alcohol and drug or mental health issues. And as a result, many gamblers never seek help. That the studies say 7 to 12% of problem gamblers will seek help. And that they might seek help for something else, but they won't mention the gambling. So the stigma and the shame and secrecy are those factors combined together. And you might ask them straight, is gambling an issue? And they'll just say no, because they're used to saying no about that one. One of the key other elements is faulty cognitions. If we had time to do a little game here today, which we don't, we might find that our own thoughts start bending once we start gambling. And it's amazing that we as human beings, that our very logical minds can shift once we start getting involved in a game of dice or something like that. So the main ones that have been investigated, and these were actually explored in the household survey, so some numbers come up and they show you the data from the household survey. This one says, I'm losing, but I should keep going as I don't want to miss a win. Right? So 57% of the problem gamblers think that. They actually act on that thought. And the others are there. And it also sometimes applies to those who are recreational gamblers as well. Like, it's not just recreational gamblers are exempt from this thought. And we, here in this room, if we did the game, we might not be exempt from this thought. A near miss means there's a win just around the corner. And earlier this year, I think somebody in Victoria tried to take a gambling manufacturer to court because they had too many near misses on the first two wheels. As expected, they didn't get too far. The court threw it out. Another one is, after losing many times in a row, I'm more likely to win. And I would add, I'm more likely to win big. People think, I've lost that many times, I'm going to win big, so I've got to keep at it. So it becomes this sort of snowball effect in the mind of the thinking. When I lose money, I try and win it back. So for problem gamblers, that's a real sinker. In the previous study, household survey, it was up as high as 90%. That figure's dropped back down in the most recent survey. But people said, as problem gamblers, that's the main point that actually sinks them. They're trying to win back what they've lost. And as we know, the game is set for the house to win, not for us to win. So, given all those thoughts, it's very hard to control time or to control spending. And if you've had some substance or alcohol in the process, that makes it even harder, because our ability to manage our urges or desires reduce. One of the other things is that sometimes there's unexplained absences, and I mentioned the secrecy before, but people might go, say they're going off to get some milk or bread, and they come back 3 or 4 hours later, perhaps not with the bread or the milk, but they've gone. So unexplained absence is often a hint, even for you in working in the field of alcohol and drug or mental health, that when things don't quite add up, don't take the first reason they give you for that as the real reason. There could be something more. So just keep your antenna up. So in terms of why we screen, it's because of the characteristics that I'd mentioned. So the shame is a barrier. Higher degrees of shame and stigma seem to apply to gamblers. I don't know why, in terms of any reason why, but in my experience of working with gamblers, and I worked as the manager of the Gambling Help Service in North Queensland for about 12 years, and seeing people through that service, it was that often when they were under stress and there was arguments in the household, what do you think they'd be being told? They weren't being told that I love you, you're a nice person, I understand your gambling. They were told you're screwed in the head, or a few other blip words that would be thrown in there. So most of them think that there's something seriously wrong with them. Other people, if they have alcohol, drug, or some other type of substance, that explains why they go off there, that they lose control. But with gambling, often they can't understand why they lose control, and so they therefore take it back as there's something fundamentally wrong with me. And that's an issue of the human condition, I know, but when it's applied to them, it seems to put that shame and stigma up to a different level. The other thing is practitioner bias. And I'd have to be the first to put my hand up and say I was very guilty of practitioner bias before I became involved in the Gambling Help Service. I never thought about gambling as an issue in anything else, really. But once I started working in there, it was amazing at how hidden it was. So problem gamblers who attend alcohol and drug and mental health services certainly won't mention their gambling, but we very rarely ask about it. We never mention it. There's no systematic screening for gambling around. There was a study done last year in mental health, and a lot of the practitioners said, look, gambling's just not an issue when people are in crisis. When they started exploring why people were losing, having crisis in their mental health, or actually being readmitted to acute centres and so on, they found that they were not taking the medication. Someone then decided, well, what's happening that you're not taking your medication, rather than just putting them down as people who weren't following the suggestions or were resistant to medication or something like that. Well, we didn't have the money to buy it. Why didn't you have the money to buy it? Gambling was there. So it's a little bit of our own bias, and I know I've spoken in these groups to people and said, screening, systematic screening is good, and people say, oh, that sounds good, but I probably won't. I'll only screen if I think people have got a problem with gambling. And so when I point out that that's 2 screens, they are not necessarily convinced. However, it's our own practitioner bias, and I think it's something not to be ashamed of. It's just something, well, how do we manage this and how do we work this if this is going to be a benefit to the clients? So, screening for gambling may help us help people in their lapse and relapse factors when they've actually had treatment for alcohol and drug or mental health. I know certainly in Lives Live Well there's been stories of people being 6 months in rehab, and in the last week gambling gets mentioned. And then, well, what in the hell are we going to do with that if we've got a week to go? So it's then, and it hasn't been considered in the relapse plan. Or there's stories about people moving from alcohol and drug and then they take up gambling as a sort of alternative way of managing whatever it is they're trying to cope with in their life. So these are the factors listed there that also underpin that, and I think we've covered them pretty well already. But the main thing is that physical health is also impacted by gambling. If you've got no money and you're stressed out and you're trying to win something under pressure, and sometimes you see people tearing their hair in pubs and TABs and so on, that has an impact on their physical health, not just their mental health. So I'm going to look at who is most at risk, I'm going to use the information from the Queensland Household Survey, and it supports what's in the rest of the literature as well. But in the most recent survey, 46% of the sample were males, and yet the males accounted for 67% of the problem gamblers. Now, it doesn't mean that women don't have any problem. It's just that they don't have 57, they're the 23%, do my maths there. And it varies over all the categories. However, what group of males do you think we might be looking at? Just given what we talked about. Somebody said younger males, yeah. So the young men, 18 to 34 group, makes up 17% of the sample. And they account for 38% of the problem gamblers, 33% of the moderate risk gamblers, and 41% of the low risk gamblers. So young males, and if they're experimenting, they're taking risks, they're in social groups, they're egging each other on, so they're going to be into at-risk behaviours. So if you put gambling, alcohol, drugs, trying to impress, a little bit of hairy chesting, all those things, then it's a pretty good recipe for getting hooked into that. And especially if they've got a high-paying job, often they think they're bulletproof, and the high-paying job is a real issue. They spend it. I know certainly a couple of years I had in Mount Isa, they were very high-paying jobs in the mines in Mount Isa. There were several people who came who were broke saying they just can't manage their mortgages, and they usually had a couple because they had a house on the coast and a house in Mount Isa. So that the actual level of income sometimes doesn't equate to a problem. Right? It just depends on how the person's managing whatever's going on. But if they've got a lot of money, they're usually spending a lot. So these are some other areas. So we've got the males, we have family history. Aboriginal and Torres Strait Islander people are high at risk. Another group are people from corrections, people who've been in the corrective services system, are often much higher. Culturally and linguistically diverse groups are often higher. That's a bit of one that might needs a little bit more explanation. People from culturally and linguistically diverse cultures often have limited access to gambling in their own countries. And so when they come here, it's very open and it's like, hell, everybody's doing it, so in they go. It's not that they all do it. It's not that as a group that there's a lot of them doing it, but the ones who do get involved tend to get involved deeply, and it's hard to get out. And then the family suffers a lot as well then. So they're dealing with the whole relocation issues, grief, culturally, all those matters, plus gambling on top. Sometimes little comments like people are using gambling to help pay their bills are indicators that gambling is a real problem for that person. So it's like the little hints are the ones to look for, because they may not be very keen to volunteer the information. And that adds into the point that by having a tool which you can have a conversation about is better than asking a direct question, I think a confronting question, do you have a problem with gambling? It's more, how do we know that in alcohol and drug or mental health areas that gambling can be a factor that people often don't consider to be serious, but it can have an impact. Can we have a conversation about gambling? And then you can go through the screen. It's just a little bit different than actually doing the straight between the eyes, have you got a problem or not? In the gambling literature, there's often little distinction made between diagnostic tools and screening tools. And when there are distinctions, they're often very confusing, or they're just simply not accurate. DSM actually is not a screening tool, it's a diagnostic tool. And as a result, it needs someone trained in that to administer it. You can run it through, I can run one through, but technically I'm not equipped to be someone diagnosing disordered gambling in that category. So as a result of that, all these different types of screens were developed. So has anybody heard of SOGS in the room here? SOGS is called the South Oaks Gambling Screen. I think it's somewhere in Illinois, a university in the back blocks there somewhere, that have developed, it's called the South Oaks Gambling Screen. And that's used a lot in the US. It was used a lot in Australia up until probably about 2002, when the Problem Gambling Severity Index became the tool that was used in Australia. But it's a fairly long tool. It's into the 30-something questions, so it takes a bit of time. Another one is the VGS. Have you heard of that one? No? Okay, it's Victorian Gambling Screen. So it was developed here in Australia and Victoria, but it's a variation probably of the Problem Gambling Severity Index, the Canadian one. The 8 was developed in New Zealand, and that is actually, there's a little self-help book that the Queensland government have out for problem gamblers, and it's interesting that the 8 is used in that booklet, and yet the government in their other research uses the Problem Gambling Severity Index, so it's just interesting that it's popped up in there. There's also called a brief biosocial gambling screen, and that's something that was developed out of DSM to try to make it a screen, so they dropped it down to about 3 questions or something like that. There are a lot of very short screens. There's a lot of screens in the sort of 5 to 9 range, but none of them have really proven their validity or reliability above any of the others. They're all reasonably good. No one says they're terrible. So it's a bit hard which one to pick. So in making our choice, we chose the Problem Gambling Severity Index because that's what the Queensland government uses, so we can compare our results with the results in the literature that's been developed here in Queensland, and internationally it's used a fair bit too in Europe and Canada, UK, New Zealand, so on. So let's have a look at it. Has anybody used or seen the Problem Gambling Severity Index? But on the screen, you can keep looking because it'll all be on here. So the screen has 9 questions. The first 4 questions look at gambling behaviours, and the last 5 look at adverse consequences. So the first one is the bet. How often have you bet more than you could afford to lose? So if we're having this after a little bit of an introduction like I suggested earlier, it's not quite so harsh as, are you a gambler? Is it a problem that's causing you much grief? The next one looks at tolerance. Are you actually needing to gamble with larger amounts or for longer time just to get the same feeling of excitement? The next one looks at the chase. Have you gone back another day to try to win back what you've lost before? How often have you borrowed money or sold stuff, someone else's stuff might be more the point, to get money to gamble? Because you hear stories about, say, someone's got grandma's wedding ring and it's been tied up in a little bit of tissue paper at the back of the drawer and it's been there for 20 years. And when they go to pull it out to show one of the grandkids, it's not there. Wonder what happened. We must have had a break-in, yeah. But there's no locks broken. So these sort of mysterious disappearances in households are often signs of this happening. And cash converters is usually a good place to start. Next, it goes on to the consequences. So this is a felt. How often have you actually felt like you might have a problem? The next one, how often has your gambling caused any health problems, whether they be physical or mental? How often have other people criticised your betting or told you had a problem even if you didn't agree with them? Right, so it's just looking for hints around financially. How often has gambling caused financial problems for you or your household? So again, it's spreading it out. It's not just for you because, oh yeah, I'm fine, just that no one's got anything to eat at home. And how often have you felt guilty about the way you gamble or what happens when you gamble? So on the online gambling help online service, you can actually do the screen online. There's a self-assessment tool there. So it just goes through, I'll just click through this because I've just gone through them. And this here now, for those in the room here, you can see at the bottom of your page the scoring. But for those on the webinar, so a score of 0 means it's a non-problem gambling. A score of 1 or 2 is low, 3 to 7 is moderate, and 8+ is problem gambling with likely loss of control, or possible loss of control, but certainly negative consequences. So a score of 27 is not uncommon when people are in that high level of problem gambling. Right, so that's ticking 3 for all questions. There's 9 questions, 3 7s. Was it 3 9s or 27? Get my numbers right. And 2 and 7 add up to 9. So 9's the magical number. So are we okay with that? So it's fairly simple to look at, and then it's a matter of looking at that. So on the in my presentations of this before, I haven't had handouts in terms of that I'm often travelling and it gets a bit weighty. So what I've developed is it's a electronic pack, a resource pack, and for those in webinar land, you can get that by clicking on the folder button down the bottom of the page. Yep. So if you want to download that, you can, and it gives all the online links, and you can click through it. There's a few other documents there, and one of the other documents is that it's a little brief interventions handout which goes through the scores and what you might do at each level on the scores. I haven't got time to go through all that today in great detail, but you can do that, and if you have any further questions, I've got no problems with people sending me an email or calling me. For those in the room, if you would like that pack, if you could just make sure you put your email address on the attendance list, I can then just email it to you, and that would be that's how you'll get it. Unless Jeff or Liam can send it to you if they know who you are and if you want it. So seeking help. So one of the issues that I mentioned before was that 7 to 12% in the mainstream peer-reviewed literature says 7 to 12% of people actually seek help who have got a problem with gambling. So a household survey actually shows it's a bit higher than that for the group. But what they did, they asked 2 questions. Have you ever wanted to get help? And 30% said yes. Have you actually tried to get help? And 20% of them actually tried to get help. So people will often say that they're thinking about or they'd like to have help, but they don't actually take that step to get it, or they're not sure how to go about that. And the shame and the stigma, I think, is one of the key factors there. And when they do seek help, it's put nicely by saying that they're often urged to do so by another. And that urge usually looks like, if you don't do something, I'm out of here. So it's usually an ultimatum rather than an urge. And so the person then has a choice, and whether I'm going to stop and do something about it or whether I just keep going. And some of the other reasons why they seek help are listed there. In terms of providing interventions, the recommended treatments are surprisingly or unsurprisingly cognitive behaviour therapy, motivational interviewing and motivational enhancement therapy. Now they're most of the therapies or the key therapies used in alcohol and drug and also mental health services. So in terms of practitioners needing to actually take on and learn up some more skills in working with gambling or providing brief interventions, there's not a lot technically that you need to do. However, I remember my own starting into gambling counselling, and that I felt very out of my depth. So my readiness and confidence, to use some motivational interviewing terms, was not high. So in terms of going into this area and working in this area, looking at your own readiness and your own confidence to do it is important, and then making a plan. What do I need to actually get there? There are books around, but a lot of the online services, they will actually have bits for little just going through. I found even going through the self-help books with people really helped them, because then they could see what we talked about in the session, and then they could go over it at home, or they could take it home and go over it with other people if they were able to talk to others about their gambling. Sometimes self-help is dismissed, and often self-help is put down to, say, groups like AA or Gamblers Anonymous. But in some ways, I don't think they're really self-help groups. They're supported help. They're not therapeutic help, but they are a supportive environment in which to try to take on the issues you're facing. Self-help more is that I'm finding, especially with younger people, is that they want to get on their phone, because that's what they gamble with. They want to get on their phone and see what's online that might help them if they've got a problem. So there are plenty of apps for gambling. There are also lots of apps for abstaining from gambling. So as practitioners, even just looking through the App Store and seeing what's there, you might be surprised by what's there. So, and that's part of their concept of taking control, because they have no control in their gambling, that to try to get some control in their life, so the self-help. So as practitioners, if they do actually start talking about it with us, how we might support them in that is the key factor, I think, too, in actually providing help to people, even though we put this under the title of self-help. Have people heard of self-exclusion in the room here? Yep. So some have. So self-help is where you actually go to a venue and ask to be excluded. And they take your picture, you sign a few forms, they give you a 24-hour cooling off period, and then it applies for 5 years. You can apply to have it lifted, but you have to show that you've actually changed your ways, or that gambling's not affecting your life as it was. So it's a fairly, you tend to have to go to every venue. There's some venues that might apply it across if they're owned by the same people, but it's a bit of hard work. Yep, you do it. It also applies to keynote or lottery products. All those regulated environment have an exclusion clause in their contracts, and they have to provide self-exclusion to patrons. If you want to Google it, you'd be surprised what you'll find under self-exclusions. Also, money management. It's actually, sometimes people say, oh, we'll do some budgeting, but sometimes financial counselling is important, because they understand all the legal issues around that, and that there can be ways where people can actually get some relief from their debt for a period of time if someone's working on their behalf and talking to the people they owe money to. So some of the things to explore if you decide to look at doing some brief interventions with people are ways to normalise shame, grief and loss. As gamblers, like people in the drug and alcohol field, have often lost a lot. So that's something that needs a little attention. Dealing with internal and external triggers and ways to manage secrecy, and often that's finding someone they can talk to other than you. Strategies for limits, addressing faulty cognitions, managing urges, limiting substance use when gambling. So they're not uncommon in what the work you'd be doing already. So it's not a lot of new, it's just honing the lens towards gambling. There is a lot of online, which I didn't really concentrate a lot, there's a lot of online tools around that you can get to. And in that resource pack, I've got a lot of links directly to those packs so that you don't have to go searching for them too much. The other thing is that there is the Gambling Help Service that is, there's 14 locations across Queensland. If you've never heard of it, then in that pack there is all the list of the services and their phone numbers to contact them. But you can Google it online too, you'll find the Gambling Help Service that'll take you to that. Or to ring the 1800 number, for gambling, which is a 24-hour number, they will link you to your local Gambling Help Service. So with brief interventions, I think the main point is that if you use the screen, that in itself is an intervention. If it raises the awareness for someone that actually gambling is impacting this issue that I've got in my life, when they might not put two and two together and come up with that conclusion. They often think gambling's not a problem, I'm coping all right, it's just all this other stuff that's causing me trouble. So if you can talk to someone and have a conversation, do the screen, and they have some awareness that gambling is impacting them, that's a big shift for them in their life, because now there's an awareness that wasn't there before. The next thing is to focus on the impacts of the gambling and the harm that may be present or that it may come if they continue to their gambling. I've already mentioned the scales of using scaling as in motivational interviewing for readiness and confidence for the client. That's a good thing too. Some people might not want to do anything about it, and that's fine, but at least you know that it's a factor and it might be considered in relapse discussions that you're having and how they might manage it. So I've already mentioned the specialist services. So you can get online by ringing the 1800 number, you can talk to somebody, you can get some sort of support there immediately. They might even refer you to counsellors in your local area if you want to go there, or they will actually assist you in maybe an online chat or online counselling that's available. You can control your gambling, which is in this picture, is a little booklet there that is the self-help guide, and you can download that off the Queensland Government website. Also, if you go to any of the Gambling Help Services, they will have hard copies of those, so you can go and ask them if they've got a few copies and have them that you can use with clients. So in summary, gambling is an issue that is really a comorbid issue in a lot of people's lives, and it tends to, the main effect is that it jeopardises recoveries. That while ever it's hidden, people are not giving it any attention, so they may go out and have a lapse with their drug or alcohol, but really it's actually been due to the gambling that's not been recognised. So faulty cognitions and chasing losses keep people trapped, and shame and secrecy often keep their behaviours hidden from their loved ones as well as health professionals who they come to see. Young men have the highest risk, and there are several other risk categories that we mentioned, and screening using the Problem Gambling Severity Index can be a way to start a conversation about gambling and the impacts it's having in people's lives. So if you're feeling confident and ready to go, I would encourage you to have a think about how you might use that with your clients. And Gambling Help Services are available 24 hours a day, so 7 days a week, so please make sure people have that number if they are talking to you about gambling. In the little resource pack, there is also a page called an activity sheet, which has 3 columns, has use of the Problem Gambling Severity Index, brief interventions or referrals. So if you are using the tool, keep a record of what's happening there, and I would love to hear from you in a while if you've done that, to let me know what's happened with that. I'd love to be able to email you a little survey, but I'm not sure that our technology will enable that to happen. So, but keep a record and just to have a look at what's happening. And if you need to contact me, there are my details there. Thank you.
Thank you. Yeah, we've got time for a few questions. Are there any questions from the audience?
Hi. It's a fascinating field and one we obviously miss a lot. You mentioned young men. I'm just thinking in parallel with some of the trends over time with alcohol, that there's that other peak in the sort of baby boomers, Gen X, round about retirement, divorce,
Yep.
and we see a peak in drinking. Does that demographic also have a higher peak?
I think it probably does, but it might not come up as a peak, but it sort of just blends in. And when you look around, it depends on what the product is, what they're using. So young men, I know, worked in Townsville, and with all the military people in Townsville, that often units would go out in groups and go to the casino for maybe even a weekend. It's but it would not, and I very rarely saw anybody from the military, because they very rarely sort of broke ranks, if you like, to admit that there was an issue. And I think that might apply to alcohol and drugs as well. But when they did, there was a couple, they talked about things like, it's got to be worth my while, so I'll need 3 or 4 grand available before I would go to the casino. Like if I got $50, I'm not going to waste it gambling. I want to have a good time, so I'm going to need 3 or 4 grand. Right, so it's a completely different way of thinking in those things. So if you've got half a dozen blokes going and all taking that much money, like it's going to be an interesting weekend. The other thing is with older people, they're not going to the casino, or they might be at their local club or pub, and they're there every day, and they're just putting, they're spending 2,000 or 3,000 or 4,000 or 5,000 over a year rather than in a weekend. So I think sometimes just the pattern is not consistent across all age groups or gender. It's actually depends on where the people are. But if you go down to clubs and pubs, you'll find a predominantly older group there in the poker machines, especially during the week. On the weekends, it's probably a younger group. I'm not sure that answers the question, but it's not just young men who have got the problem. It's all the different categories have it. It's just that they're the highest.
I mean, I think that's fascinating, because it seems to mirror, if you think about alcohol consumption patterns, the younger folk, it tends to be a binge pattern, Friday, Saturday night.
Yeah.
As people get older, you're more likely to be a daily drinker of enough to do you harm, but not binge pattern. So what you're describing is almost identical.
Yeah.
Which I
or
think
it's
is
called a pickle pattern.
Interesting.
Keeps you pickled.
Yeah.
So yeah.
Thanks very much, Gerard. I was interested in the patients that I see who I become aware of having gambling problems, and I confess I don't screen everyone.
Yeah,
so
that's
do that differently. Often it's in the context of heavy substance use, so they start with the alcohol, maybe then methamphetamine, and that's when they go to the casino. So the approach I've taken is that if we can control the substances, then generally the gambling settles down completely. Do you think that's a legitimate idea, concept?
If you're considering gambling while you're doing that, and I think if you're just trying to control the substance and you're not thinking about the gambling, I'm not sure that it is. But if it's included in that, and that's part of the explanation of where you're going with your support of the person, then I think that's as good as any. There is an article by Blazinski and Nauer, and Blazinski worked for a long time in he's still there, although he's certainly getting older. He's at Sydney University, and he put out an article in 2002 on pathways to gambling. And actually, I have sent Niall that article because I sent him the resource pack to put up on the website for today. But that article actually goes through the different pathways that people come to. And the final one where people are often entrenched is that it's because their mental health has led them to gambling, because gambling actually gives them relief. It's a form of self-medication, if you want to follow that model and theory. So if you reduce the substance or that, it might not have any impact on the gambling. So it's just a thought. But I know, in terms of getting into that category, I'm no expert in that area in terms of being able to comment much further, I don't think.
And I heard recently, in relation to the pokies, people use them to relieve their stress and escape from their day-to-day. And paradoxically, sometimes they actually resent getting a win or a jackpot because it interrupts that. So that is just bizarre, isn't it? It's no longer about winning or losing. It's about putting something into a machine to keep you.
So I've had people ask people why they gamble, and they'll say, because I want a big win. I say, well, what's a big win to you? And they'll say $1,000, $1,500. And I'll say, well, how many of them have you had? Oh, about a dozen. And I said, what did you do with it? Well, I put it all back in. So then I said, well, so the win is not really the issue. Right? So it's really the exploration of actually taking what they say at face value and then exploring it, say, give me the evidence that that's the case. Because if you won the $1,500, do you go home? Oh, hell no. I'm right now. I can keep going. And it's still called a win, and the machine will call it a win. But it's actually not. It's a drop, if you like. It's actually a pay. But it doesn't account for all the loss that's gone before it. But for some people, spending $600 or $700 for a 3 or 4 hour session is actually a relief. But it's just that when they get to the end and they're then broke, then the actual level of their anxiety and stress is then blown out again. And so then they're looking around for, how do I get more money to get myself a calm again? But I suppose it could be, we could also even, not that I'm can't diagnose these things, but it could even be looked at as a form of OCD, where it's actually bringing relief, and but it's just a costly form. It's not just washing your hands and taking the skin off them. It's actually just keeps you poor.
Thanks, Gerard. Gerard, I just wanted to see if you have a comment on this. I'm an avid AFL watcher, and I just feel like in the last period of time, the sports betting advertising has gone off the Richter. Who's responsible? I just feel like it's just endless. And we're talking about the young males who are the problem gamblers. It's primarily young males watching sports, and the advertising seems to have just even superseded so many other advertisements.
And it's kicked in. I think it was probably around 2012 when it kicked in. But certainly in any of the football, cricket, any of those things, it's just on. I'd say politically it's getting to a point where it'll probably go the same way as smoking, because people are just starting to get sick of it. And even in the recent election in Tasmania, and Tasmania is a special case because all the gambling there is run by a single business, which is family-owned business, which is politically there's a lot of issues about how that happens. We won't go there, or I might be out of a job. Is that the regulator also takes the cash, and so most governments have got a lot of their revenues coming from gambling. And if you want to look at those figures, I can give you a website where you can look at it and knock yourself silly with it. But it's billions of dollars in Australia that governments are getting from gambling. So it's a real issue. But in terms of in that area of gambling in sports, and it's for family viewing, there's no over 18 limit in that advertising.
We have young males
from babies.
14,
kids can.
And females.
Yeah.
And so I feel like it's just a barrage.
Yes.
And giving these ideas that just go ahead and do this because it's okay.
I think start a political campaign. There you go. But I think it's the solution.
smartphone these
Absolutely,
days.
so there's no sense, is there?
Anyway, I'm conscious of time, but we can talk.
Two more questions.
Gerard, I just wanted to say I got back 2 weeks ago from Vegas after ironically having won a trip there.
Good on you.
And I forgot to gamble while I was there, but what was an eye-opener for me, I was staying at the Venetian, and in the middle of the Venetian, there's a fountain, and all the money you put in the fountain is donated and matched by the owner of the Venetian to his wife's clinic, which is the Addleton Clinic for Substance Dependence. And I inquired of them did they also treat gambling, but they said no.
Yeah.
Take that for comment. And lastly, there was an online question, or a couple. Can you recommend any specific apps for problem gambling?
I can't. Off the top of my head, no. But I can have a look at that. If the person would like to email me, that would be good. Yep.
And there was a question around the best way for gambling help services to encourage or, I guess, request other service systems to implement the problem gambling screening index or doing more gambling screening. I guess that's a difficult question to answer, but maybe webinars like this, for example, like Centrelink or other types of services.
Well, this I think this project is a pilot project that's funded by DJAG through the Department of Communities, and DJAG is the regulator. So they're looking at doing something here. Whether the funding continues is being decided as we speak, I'd say, because I'm supposed to be only here by the end of May, whether the funding will improve, or not improve, continue. So it's really only by being put out. I think that the next step would be where organisations, and Queensland Health is a big organisation, start looking at how do we put a systematic screen in. But if we're looking at Queensland Health, mental health, what are we, 30, 50,000 people, so 9 questions might be too many. But in terms of giving it a try in your own area, that I think that's something to give it a try and just to see. But certainly in Lives Live Well, it's higher than 30% mostly that problem gamblers are showing up in this population.
Excellent.
Thank
we'll
you.
have to draw a line out. Join me again, and thank you, Gerard, for
Thank you.
interesting topic.
Thank you.